And the speaker who spoke here from private talked very well about financing of healthcare system. But Your Excellency, you can imagine how many people in this country depend on private institution for healthcare. Very few. So the largest population is still untaken care of. So basically, Your Excellency, I would request you kindly, in the next parliament, because we know that there are people who have not been able to go to parliament through the normal process of going to get elected by the public. But we can nominate these people to parliament. We know them. We can nominate them. And when we do the nominations, we will still nominate the politicians who have never seen a mother coming to the hospital with a child for a whole year, and that child ends up dying. I want to give you a very good example. I've worked in Kenyatta National Hospital Critical Care Unit from the year 04. And I want to tell you, we struggle so much when a patient comes from theater. If you come for a night shift, the whole of 14 hours, you are on your knees, measuring urine, measuring blood, every drop of fluid that is coming from the body of that patient who has come from theater. And we struggle. The doctors don't sleep. And we ensure that that patient who has come from open heart surgery has recovered. Good luck, 7 days, the patient is taken to the ward. And we are very happy we have done a good job. And after another 7 to 14 days, the patient has improved quite well and is discharged to go home, Your Excellency. But do you know what? The bill is 2 million. Where do these people get the 2 million? The NHIF cannot cover the whole bill, and so it covers just a portion of it. So what happens? We retain those patients in the ward. And do you know what? Because of the congestion in these ones, we put those people on the floor. They start sleeping on the floor. How many days can you sleep on that floor? You will sleep there for 1 day, the second day, the third day, you can't even breathe. Your chest is already congested again. And what happens? The patient that we struggled so much in ICU for all those days, the patient who was well in the ward ends up getting reinfected. And do you know what? We have brought back that patient in ICU, and the patient dies when we are resuscitating. That is basically the scenario and the pain of healthcare providers. Your Excellency, kindly, as I finish, make sure that in your government, because I know we will pray for you as healthcare providers, you ensure that you nominate a few healthcare providers in parliament so that we will come to help you ensure that the issues of healthcare are well articulated, Your Excellency. And I stand here to confirm to you that these healthcare providers will be behind you. And now it's my humble pleasure to invite the General Secretary. Is he around? Yeah, Mr. Panyako of the Kenya National Union of Nurses. Welcome, sir. Thank you very much.
Maybe before you leave, I want to say this, that a lot of the health laws that are brought by government, including the NHIF, are not addressing the issues that you wanted to be addressed. They are busy removing unions from key positions in the health sector. And that is why we were keeping them. So when the health professionals sitting behind me write to me that these are not the right laws, the only way I can help you is to keep the law pending in parliament. So don't blame me, and I'm sure we are going to do it. So I was saving you sometimes to make sure that the minister's business was just to remove you from critical bodies we felt that affects the men and women who are sitting behind me.
Wow. And that is why when you are appointing, kindly, you can appoint some of us, and we will be able to articulate the issues of health in parliament. Thank you very much, sir.
Iwapo unapenda habari nazokuletea, basi subscribe kwenye channel hii ili uwe unapata uhondo kila wakati. Shukran.